A lot of the most promising solutions we've seen at South by Southwest so far this week all use one very precious, very hard to gather resource in order to deliver real results, and that's personal health information. This creates a problem for companies which are trying to deliver customizable, personalized health outcomes that people expect while not treading all over their privacy concerns. How do you, on the one hand, deliver those personalized results while being focused on privacy? And no one has one clear answer to how to do this, but we found a few clues so far that give us a sense as to ways in which companies can go about this. The first one is to treat personal health information as private and gated. So if you are going to be collecting people's information, don't just sell it to the first bidder. Now, this should be obvious to anyone who spent a little bit of time dealing with FDA-approved digital health apps. However, it also has applications for how you present the experience to someone. So no one's going to go out there and create the next Gmail for health and then use all those data and market it to the highest bidder. But at the same time, people who are going in to use these personal health apps are doing so with the expectation that you're not going to market it to anyone, and furthermore, it's going to be a private, gated experience similar to what they're going to get at their doctor's office. So the level of trust that you need to build as a designer of those apps needs to be similar to the level of trust that the patient is building with a doctor. Number two is to keep it simple. And when I say simple, it's as simple as is needed to solve the problem at hand. It's very tempting when you're designing a web app to put a lot of bells and whistles on there and have a lot of different functionality in the name of driving engagement. That looks great for your KPIs. But on the flip side, any performance indicator that you're trying to meet is going to require a certain amount of health information in order to hit it. And that means more information than you're collecting from the patient. So it's important to, if the patient is coming to your website, say, to find out if they're at risk for Parkinson's, solve that specific question and only ask the data that are needed in order to get them there. And furthermore, draw a very clear line between the information you're collecting and the output that you're giving them with that digital health solution. Number three is to create a socially relevant solution. Now, this doesn't mean taking their information and putting it on social media. Going back to the private gated experience, that's not what patients want and that's not what they expect. Rather, it's helping us as human beings do what we do best, which is communicate with each other. And there's so many problems within the personal health experience that require a lot of routine, automated tasks. Those are the perfect tasks for back-end functionality in digital systems that can help us spend less time checking boxes and doing things that are difficult and more time communicating with each other, facilitating the interactions between doctors and patients. Now, two companies that were doing this pretty well or were proposing things that were cool in this space were Curatio, which is essentially a matchmaking system for patients with given conditions, and Baby Scripts, which was providing OB-GYNs and mothers with a set of tools that helped them to get through the pregnancy in a much more informed fashion, help them to communicate on all the milestones along the way, and finally helped the mothers feel much better that they were getting the level of attention from their OB-GYNs that they felt was important to have a successful pregnancy.